Welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. My name is Chuck Jones. I'm with Synergy Broadcast, and I'm pleased to welcome our guest today, Fran London. Fran is the health education specialist for Phoenix Children's Hospital out in Phoenix, Arizona. She is a noted author of many articles and 2 books, the most recent of which is No Time to Teach: The Essence of Patient and Family Education in healthcare. And Fran is our resident expert on all things related to patient education. Hi, Fran.
Hi, Chuck.
How are you?
Good.
Well, today's topic is all about, well, not all about, but we're going to spend some time talking about handouts and kind of how to use them, when they're effective, things of that nature. And I know this is a topic that is near and dear to you could probably write a whole book just on handouts, right?
Yeah, probably. I'm not sure who'd read it, but yeah.
Yeah. Well, hopefully somebody who wanted to know, how do I do this? Well, I know you've heard the stories about the people that say, yeah, I got a handout, but it had been Xeroxed so many times I couldn't read it. And I'm sure that there's still some of that. But let's start at the top, and let me ask the question, how effective are handouts today? Because everybody's kind of YouTube oriented. Are they still effective?
Oh, absolutely. They're really important because people often forget what's been said to them. So if they could take something home to refer to and look it up, it really helps a lot.
Okay, that makes a lot of sense. Do you look at the handout as the educator or the tool? I guess what I'm looking at is, if the nurse comes in and hands me a handout and says, read this, and walks out, have I been educated?
Absolutely not. One of my favorite sayings is paper doesn't teach, people do. Paper is good for a reference. It's good to refer to later. It's good to reinforce by putting the same information in a different format, but it doesn't teach at all.
Okay. So, but before we talk about how to use it, let's talk about the different types of handouts. In my mind, there are 2. One is going to be the slick color brochure that you get either from a pharmaceutical company or from one of the education companies, and they produce volumes of these. And then the other one is the one that's made in-house, either by the doctor or a nurse or an educator, and it's typically black and white, typed in Word, that type thing that they just copy. Is that the 2 basic types, or is there something else?
Another one that's coming up more often now is something printed off the internet.
Okay.
So there's lots of internet options that people just Google and whip it off.
Sure. Now, the ones that are coming off the internet, are they formatted for printing, or are they sometimes just printing what's on a web page, so there's a bunch of junk?
Both.
Okay. All right. Well, with the options that they have available, where they can use them from a provider, create them themselves, or take it off the internet, how should an educator use a handout with a patient? Is there one specific way, or what's the best choice?
The basic way to use anything in patient education is to think about involving the learner in the process and individualizing teaching to the need of the learner. So the first thing you have to do is choose the right handout. So you have to individualize it, figure out what it is this person needs. Very often what is needed is instructions on how to do home care, because
Okay.
you've told them what the diagnosis is, so you don't need 28 pages on what the diagnosis is about. What you really need is, what do they do to take care of themselves? What are the problems that can happen? What do they do if they see a problem? So that's what needs to be in writing.
Okay. Any concerns about the patient's education level?
You want it to match on some level. So basically, you've done the assessment, you've talked to them, you've found out where they're at, and that will help you decide whether you need something with lots of pictures, if they can read it all. And even if they can't read, sometimes it's useful to give them a handout because there are other family members who can read.
Okay. That makes a lot of sense. What are some of the most common mistakes that nurse educators will typically make when using handouts?
The biggest one is to hand it to a patient and say, "Do you have any questions?" and walk out, or not even ask if they have any questions.
Yeah, and of course, if you ask that question, "Do you have questions?" it's always, "No, I'm fine."
Right, right. Yeah, it's really important to assess whether or not they understand the important parts in the handout.
Yeah, and what's the best way to do that?
A real good way is to hand it to them first after you've assessed that they can read. Tell them to read it and that you'll be back to talk about it. And when you come back to talk about it, come back with a highlighter and highlight the real key points, because they're not going to be able to absorb everything in one sitting, no matter how short it is. But you want to make sure when they get home, they can find what they need in a hurry, the phone number of who to call, the danger signs, whatever it is that's important.
Okay, that makes sense. So don't just hand it to them. Make them review it. Use TeachBack to get them to tell you back what they understand, and then use your highlighter. If you don't have a highlighter, at least use a pen to be able to mark it up. Yeah. Okay, makes sense. Well, how would you go about choosing if you had multiple options for handouts? You touched on this briefly when we were talking about education level. Is there something else you would use in terms of deciding what handout to use besides education?
Well, if you have lots of choices, first of all, I would make sure that what you have meets the policy of your organization, because some organizations specifically say you can't print something off the internet and give it to a family or patient. The other thing is, if it's coming from a pharmaceutical company, make sure it has some content about what it is you're trying to teach. They may be very pretty and free, but they might not have the instructions that they need for home care.
Yeah, sure. I would think a lot of them may be written with a PR slant to them as well.
Which isn't necessarily bad if that's the drug they're getting or whatever, but you want to make sure that it has the instructions that they need.
Okay. All right. So I guess the takeaway from that is, if you have choices, you need to weigh your assessment with the patient with the tools that you have available, and pick the one that's going to deliver the right message and the one that they can comprehend.
Exactly.
So that makes sense. Okay. All right. Let's talk about non-English speaking. What do you do if you don't have a handout in a specific language? Should you not use the handout, or what should you do?
Well, there are a couple of things. If the person has some people in the family who do speak English, you could still provide the handout, but don't make that the focus of your teaching. Okay. That could be for someone in the household to be able to read. Okay. The other option is to call in an interpreter, which you would probably be using anyway, and use the interpreter to do the teaching, and ask the patient to take notes, or a family member if the patient is unable to at that time.
Okay. That makes sense.
And then do the TeachBack. Very important.
Gotcha. Yeah. Yeah, I don't think we can emphasize that enough, because if you're not doing that, you don't know where the patient is. Okay, that makes sense. Well, our final question for today, is there too much reliance on a handout to kind of, quote, cover the bases on education? Yeah.
If you're just thinking you have to hand out the booklet or whatever and walk away, and then you've covered everything you had to teach, and then you can document, you're wrong. It's until you do the actual individualizing of the teaching, and you do the TeachBack, and you make sure that they understand what's going on, that's what's important. In my job, I actually create the handouts for my hospital with obviously everybody else in the hospital as the team, and I tell them I'd rather be out of a job and have you actually teach and not need my handouts.
Yeah, sure, it makes total sense. Yeah, I understand where you're coming from. Well, it makes sense that this is a topic I know you can talk about a lot. We ought to schedule a future episode where we talk about some of the principles of how to make a handout and what to do, maybe perhaps how to lay it out, things of that nature, so that we can provide the viewers with some hands-on tips on how to do it. And since that's what you do every day, you ought to be a pretty good source for that.
That'd be great.
Okay, cool. All right. Well, that's all the time we have today. I appreciate you taking the time to visit with us today. You're pretty active on the internet. Why don't you tell the folks that are watching how to get a hold of you?
Okay. Well, I've got a blog at www.notimetoteach, and I'm on Twitter every day at notimetoteach.
Okay, cool. And also, I see you periodically on Google Plus and Facebook, so I know you're out there too, off and on. But
Yep,
the blog and the
there's also
Twitter
a Facebook
probably,
page for No Time to Teach.
Yeah, absolutely. Okay. And then the book, No Time to Teach, folks can still get that wherever books are sold. It's available in both paper and ebook form. So I know you can go to Amazon and some of the other booksellers. And then for hospitals, if they would like to make a volume purchase, they can do that through your publisher, Pritchett and Hull, and their website is p-h.com. That may be one of the shortest websites out there, but p-h.com. And if they just search No Time to Teach, there's an option for 40% off on a bulk purchase. And then we also include links to that in the show notes so that folks can take a look at the show notes. Some will be published on the YouTube site and some on the blog site where they can pick up that information. So I want to thank you for that. And I'd like to remind the folks that Patient Educators Update is brought to you by Synergy Broadcast and our video-on-demand patient education system called MMDS, or the Multimedia Delivery System. And if you'd like more information about that, you can visit our website at synergybroadcast.com. Well, Fran, thanks so much for being the guest again this week. I appreciate it. I look forward to talking to you in the next couple of weeks on a couple of future episodes.
Thank you, Chuck. See ya.
Okay, bye-bye.